Welcome, everyone. My name is Sierra Sanchez, webinar producer with CGLR. I'll be behind the scenes helping to produce this conversation. Before we begin, I just wanted to call your attention to our social media pages. Connect with the Campaign for Grade Level Reading. On Facebook, like the page Campaign for GLR. On Twitter, follow the account at Reading by Third. And on LinkedIn, subscribe to us at Campaign for GLR. Please use hashtag Learning Tuesdays and tag us to tweet anything you learn from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. Once again, we would love to connect on those pages, so give us a follow and we'll be sure to reach out. Okay, once again, my name is Sierra Sanchez, and before we begin, I have just a few housekeeping details. First, we'd love for you to introduce yourself, so please use the chat box at the bottom of the screen to share your name, city, or state, and your organization. Be sure when responding to select both panelists and attendees so that we all know who is here. The webinar is being recorded and live streamed on Facebook. A link to the recording, as well as any resources and slides shared during the conversation, will be sent in a follow-up email to all who registered. And lastly, we'll be posting a brief on-screen evaluation during closing and highly encourage you to respond. This helps us with our commitment to continuous improvement. And before we begin, I want to call your attention to GLR Week 2023. We wanted to provide this save the date. GLR Week 2023 will focus on bright spots and silver linings and be from July 17th to the 21st. We're excited to have all of you joining us for that event. And for our future Learning Tuesdays webinars, on May 16th, next week, we'll have an exciting doubleheader, starting with a funder-to-funder conversation on diverse books as windows, mirrors, and sliding doors, the role funders can play. And at 3 p.m. Eastern Time that same day, a session on third grade retention, a conversation about adult accountability and student outcomes. And we'll invite you to join us on the 23rd for a session on showing up together, learning and attendance go hand in hand. Registration and information for those sessions will be posted in the chat box now, and we hope you can join us. Joining you now is Becky Miles-Polka, Senior Consultant with the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Thank you, Sierra, and hello and welcome to everyone who's joining for today's webinar. I am especially excited to launch this conversation with our distinguished guests today. We have the honor of hosting the release of a new research paper jointly produced by Scholastic Education Solutions and the Yale Child Study Center. This paper has looked at the impact of youth literacy on health outcomes. As a campaign network, we have examined the health conditions that impact children's ability to learn and have provided resources over the past decade on those health determinants of early school success. Today, we will hear from our panel on the impact of youth literacy on long-term health status. Clearly, this is a bidirectional system where health affects literacy and literacy affects health. It is my pleasure to introduce our panel and our moderator for today, and I'll be posting shortly a link to the full bios in the chat. David Adams is the Chief Executive Officer of the Urban Assembly. He started with the Urban Assembly in 2014 as Director of Social Emotional Learning, where he created the Resilient Scholars Program, a unique approach to integrating SEL into curriculum and classroom practices across the UA network. It has grown into a national program serving schools and districts in Los Angeles, Houston, Syracuse, and other cities. As a Senior Director of Strategy, David led the expansion of the organization into a model provider of school support with an emphasis on innovation and equity in public education. Lee Beers is a professor of pediatrics and the medical director for community health and advocacy at Children's National Hospital in Washington, D.C. She is also the A. James and Alice B. Clark Distinguished Professor of Early Childhood Intervention and Advocacy. She's the Medical Director for Behavioral Health Initiatives for the Pediatric Health Network in DC, and she oversees the Child Health Advocacy Institute's Community Mental Health Core, which includes initiatives such as the Early Childhood Innovation Network, and serves as a catalyst to elevate the standard of mental health care for every young person in Washington, D.C. She was the 2021 president of the American Academy of Pediatrics and received the 2019 Public Policy and Advocacy Award from the APA. And she is currently on the board of the directors of 0 to 3. Linda Mays is the Arnold Gesell Professor of Child Psychiatry, Pediatrics, and Psychology and Director of the Yale Child Study Center. She is also a special advisor to the Dean of the Yale School of Medicine. Trained as a pediatrician, Dr. Mays' research focuses on stress response and the regulatory mechanisms in young children at both biological and psychosocial risk. She is especially focused on the impact of prenatal substance use on children's long-term outcomes. And our moderator today is Amanda Alexander, who serves as Scholastic's Chief Academic Officer. And in this role, she leads research and validation efforts to ensure the efficacy of products, the delivery of professional learning services, and the company's partnership with the Yale Child Study Center, focusing on the intersection of literacy and health. Prior to joining Scholastic, Amanda served as the Vice President of Policy and Partnership Development at Teachstone. With more than 20 years of progressive leadership experience, the majority of Amanda's service has been as a practitioner in the public sector. Amanda, I'm going to turn it over to you and we'll kick off our conversation.
Thanks so much, Becky, for that. At this time, I'd actually like to turn it over to our panelists to just quickly turn their cameras on, introduce themselves, and share a little bit about their organization's connection to the intersection of education and health. And we'll start with you, David.
Well, thank you so much. David Adams, Chief Executive Officer here at the Urban Assembly based in New York City. We're focused on ensuring the economic and social mobility of young people by improving public education. And we do that by investing in social and emotional development, high quality instruction, and post-secondary access. So very excited to be here today, Amanda, and very excited to be here as part of this panel.
Thanks, David. Linda?
Hi, everyone. I'm very excited to be with you. Linda Mays from the Yale Child Study Center. And as you've already heard, we have this partnership with Scholastic that we're so pleased about, very productive around the idea of literacy and health. My role at the Child Study Center is, the Department of the Child Study Center focuses on not only children's mental health, but child health broadly, and how we work across systems, not just health systems, but educational systems, to really optimize children's development.
Ann Lee.
Well, thank you so much. So nice to be here today. I'm Lee Beers. I'm a pediatrician at Children's National Hospital in Washington, D.C., and I work for our Child Health Advocacy Institute. And I guess the best way to summarize the work of Children's National and our institute is to really go back to our mission, which is care, clinical care, advocacy, research, and education. And so as a health system, we really strive to advance all of those things for the children and families in our community, our region, and nationwide, and internationally too, actually.
Thanks, all of you. Next slide, please. Just really quickly, I'd like to say that Scholastic is definitely thrilled to have this partnership with the Yale Child Study Center. As you know, Yale is a world premier institution focused on the health and well-being of children. Yale is definitely a leader in clinical practice, research, and teaching. This partnership actually began with a research project between Scholastic and Yale that was conducted in rural Appalachia, focused on the hypothesis, can literacy be used to build resilience? The pilot was successful, and it led to the creation of this formal entity, the Yale Child Study Center. Scholastic Collaborative for child and family resilience. As you can see on this slide, our mission is focused on exploring the intersection of literacy and health, which leads us to this research paper. Next slide, the research paper. Everyone here definitely knows from our own experiences with children, the impact that literacy has on a child's life. We also know the impact that education has on one's long-term success. However, we really wanted to focus in this paper on the body of research that explores the impact that literacy has on a child's short-term and long-term physical and mental health. So today we are pleased to share some of the findings with you and to discuss them with our esteemed panelists. Dr. Mays,
Yes.
Scholastic, and the Yale Child Study Center are proud to release Reading for Life, the impact of youth literacy on health outcomes, a joint research report, as both of our organizations share a passion for literacy and health. Can you begin today's presentation by sharing some of the key findings with us?
Sure. Thank you, Amanda. We're really grateful to have that opportunity. If we could go to the next slide, please. So this is the paper that we'll be speaking from. And as you just heard, this is a collaboration between our two organizations. I also want to give a shout out to my colleague, Kai Schulman, who is a Yale graduate and very much helped bring the first drafts of this paper together. So stay tuned, you'll hear much more from Kai. If you could go to the next slide, please. And start just clicking through, please. So what we know and what I'm going to talk about is how everything that is so important to us about reading and literacy also has profound health impacts. We know that literacy increases how children and families engage in education. We know that literacy can serve as the great equalizer and enhance equity. We know that reading gives children a broad stage and increases their capacity for critical thinking. It also gives them a chance to develop empathy skills. It gives them access to books and to a world that they might not actually have in their physical environment. And we know how access to books can actually impact young people's not only understanding of physical mental health, but what we're truly talking about here is not just understanding, but literally how it changes health. And we do believe that literacy is also a very key mediator between these disparities that are such a great concern of ours and the access to opportunity. On the other side of the slide, you see a study just published from my colleagues at Yale. And I think that most important is to see the size of this study. It's nearly 3,700, 3,600, 35 individuals who are 50 years and older, and found that individuals who are readers, they live almost 2 years longer than non-readers. And we'll talk in a little bit more about the impact of reading and literacy on mortality and overall illness. Those who read for, it's only a small amount, really 3.5 hours a week, were actually 20% less likely to die over a 12-year study. It's remarkable, isn't it? Reading less than 4 hours a week conveys that level of health impact. Going to the next slide, just to take a step back and ask, what do we know about literacy and the state of children's literacy in the United States currently? We know right now that over a third of fourth graders are now performing below the national basic level in reading. That's a third of children in our country. And we know that the percentage of children with baseline literacy standards has actually gone down since 1992. And then, as of course you might imagine, with the pandemic, since 2019, there's been an even more rapid decline. That should be something that would be as deeply concerning to us as as we just recently experienced over these 3 years, a tremendous health issue sweeping the country. We also know that these drop in test scores disproportionately, just as in the pandemic, disproportionately affected students that were in the bottom percentile. So those students who were more vulnerable on a range of measures are actually disproportionately affected by this change or this deep decline in their reading scores. And as I've already been suggesting, this is really staggering and quite concerning that it's hypothesized or predicted that about 67%, 2/3 of kindergarten reading skills were actually lost during COVID-19. Now, hold those two, the slide I just previously talked about the impact of reading and literacy on health. And now hold this in mind about the impact of what's happening on basic literacy and reading levels in our country. We go to the next slide. So how do we connect literacy and physical health? The data are very compelling, that lower literacy rates are actually associated with poorer overall physical health outcomes. That may include cardiovascular, it may include weight, it may actually include the earlier onset of chronic illness. And that relationship between lower literacy and poorer outcome pertains even when you control for other factors, such as demographic or socioeconomic, or even access to care. Individuals with lower literacy are simply less likely to get regular preventative health care. And we should all be asking the mechanism of that. Conversely, a chronic illness such as diabetes, that individuals with lower literacy rates are more likely to experience. But if you have higher reading skills, you're actually more likely to have better outcomes with your diabetes, better control. And that happens whether or not you have a high school degree. So on the one side, lower literacy, poorer health outcomes, but even with a health outcome and an illness that requires a lot of medical attention, if you have higher reading skills, you do better. And especially concerning in my world, the world of child behavioral health, we find that lower literacy rates at the time of adolescence, high school and in those years are associated with higher risk for violent behavior, aggressive behaviors, transitioning into substance use, those kinds of issues in adolescence that actually do set that individual on potentially a chronic health, poor health trajectory. Perhaps another way to put it that is, I hope will bring the message home, is 30 minutes of reading a day has a measurable impact on physical health that is as significant as decreasing your blood pressure. And it's a significant impact on your blood pressure, both the higher number and the lower number, and decreasing your heart rate. Just 30 minutes of reading a day. And it may actually have as significant an effect as some of the more medical health-related ways we have of treating these kinds of chronic illnesses. If you'll go to the next slide, please. And what do we know about the relationship between literacy and mental health? And even to this slide, I want to make one important point that's very relevant to what we do in the collaborative with Scholastic. While in these slides and these data I present it as separate, we actually think about child health. We don't think about the separation between child physical and mental health, because physical health impacts mental health and vice versa. But for the purposes of presenting these data, I want to divide them. So what we see is that children and adolescents who have reading disorders actually very, very often have higher rates of anxiety and depression and other associated mental health needs. What we call, in my world, we call a comorbidity, that reading disorders are comorbid, are associated with other challenges. And a third of individuals, over a third actually, with lower literacy levels also experience more mental health needs, more mental health problems, compared to only about 12% with not having mental health issues. Now, the other point to let you know about that's not on this slide, and then we'll go to some data about treatments, is that in the United States, on an average across the country, 1 in 5 children under age 18 at any point in time will actually have a mental health need. So that means in a classroom of 25 children, 5 of those children will have a need for mental health services. But most importantly, or perhaps most concerningly, of those 5, 4 will not have access to care. 80% of children with a mental health need in America do not have access to mental health care. So what we know, though, or what we're beginning to learn, is there are levels of interventions. For example, using books, or what's called bibliotherapy, may be as effective as cognitive behavioral therapy for children who have anxiety disorders. So, for example, if there's not enough mental health professionals so that you get that 80% don't have access to care, if we start to think about literacy and education and books as another way of impacting health, we have an opportunity to profoundly and deeply impact that gap in access. So as you see on this other side of the slide, bibliotherapy can be as effective as CBT, and we've known this for a while, actually, that it can reduce depressive symptoms in adolescents. We've known this for a while. The question now for this kind of partnership between Scholastic and the Child Studies Center is how not only do we disseminate that information, but how do we make it much more effective in interventions across the country? So if you'll go to the next slide. And so we know that there are a number of literacy health partnerships that have actually shown some pretty strong benefits. Just click across and we'll have them all. So Reach Out and Read is one that I hope at least you've heard about. Really impactful, where pediatricians give books and early literacy guidance to families. A prescription for 10 minutes of daily reading. And research on Reach Out and Read shows an 8-fold increase of parents reading aloud to their children and finding that as a very favorable, pleasant family activity. The next question that comes from that is, does that kind of change in family activity increase not only children's literacy, but increase it across the lifespan? And does that improve health, as the data would suggest that it should? Head Start's been around since the Johnson administration and the war on poverty. We know from now longer-term follow-ups of Head Start that Head Start participants, children who are early on exposed to reading and literacy interventions, are much more likely to be healthier, less likely to have chronic health conditions, and also lower rates of depression across the lifespan. And another of a literacy, of an intervention that's intended to improve literacy and in access to literacy and books is the Stanford Tips by Text. And again, you see on the slides, you see the data that it links physicians and visits to physicians with trying to improve literacy. So these are 3 examples that exist. But the question is, how can we together do something even more that gets this idea out there that literacy and health are inextricably interwoven. They are the same. They are a pediatrician doing a check. A literacy check is as vital as a pediatrician doing a weight check and a blood pressure check, setting lifelong trajectory for health. Before I conclude, I want to just go to the next slide and to a very recent to talk about these potential collaborations, and then on the next slide, I'll go to a recent, the concluding point. That there are a number of ways, as I've talked about, these kinds of potential innovations and bringing literacy and health together that we can do. I've already suggested that we can better help healthcare providers integrate literacy as an integral measure of a child's health, as one that's not an add-on, but is just absolutely essential. That we can have with educators to bring health more into educational settings and provide the kind of professional development we're doing right now for teachers. To help families understand that literacy is not just an educational intervention, but it is an investment in your child's health for the long haul through adulthood. And the same for communities, that having communities understand just as they, for example, would be sure that there's access to clean and healthy water in their community, parks for children to play in, that literacy is also vital to family health. So if you could go to the next slide. Just recently, the Surgeon General in the United States brought forth a remarkable statement about the epidemic of loneliness that is sweeping the country, or not sweeping, it's already present in the country, and suggesting that this is one of the long tail of the pandemic, with the tremendous social isolation and the tremendous impact of the pandemic on our social connectedness, our social fabric. Loneliness is a mental health need and a mental health issue. Social connectedness is the glue and the antidote to loneliness. But I would suggest by the picture that's on this slide that one of the most significant ways of combating this kind of epidemic of mental health needs and loneliness in our country is to bring children and families together and communities together around shared stories, around narrative, around reading, but also narrative, because we know that narrative skills as the earliest of reading and literacy skills brings people together. It builds community. So I end on this point and look forward to discussion to saying that we do have a national crisis, but we also have a crisis that we know a number of things that we can do that will have a lifelong benefit. So I really look forward to the discussion and turn it back to Amanda.
Thanks so much, Linda, for highlighting some of the research that is in the paper. I do encourage everyone to obtain a copy and read it in full. We're now going to begin with our discussion, and I want to begin with you, Dr. Beers. You are the immediate past president of the Academy of Pediatrics, so you definitely have witnessed a lot on a national level. And I'm wondering if you can provide some context for us about the impact of the pandemic on children's overall health, including mental and physical.
Yeah, absolutely. And first of all, thank you all so much for having me here this afternoon. Fair warning to everyone, I'm getting some notices that my internet is a little finicky. My colleagues here have agreed to wave their hands if I'm hard to hear. So please bear with me. It'll encourage me to keep my remarks brief, I guess. It's a really important question. And I think that the theme, as I think about it, really is disruption, right? The past 3 years have been very disruptive to our children in a variety of different ways. I think, as a pediatrician, probably the first thing I'll speak about is how it was disruptive to the physical health to children and their families. We know, thankfully, children experienced less of the physical impacts than older adults did, but even as of today, there are 3,300 children hospitalized with COVID. And so it is not insignificant. We know there are some children who are experiencing long COVID. There's been an increase in diabetes, obesity, eating disorders, other related illnesses. We also know that these physical health impacts have impacted families. Looking at some numbers actually from about a year ago, so they're even higher now. About 250,000 children lost a primary caregiver during the course of COVID. And so that obviously has tremendous impacts on children's health and well-being. And I think recognizing that children with special health care needs, children who have caregivers who may be at higher risk, are going to be experiencing higher levels of stress and anxiety because of these physical health risks, right? I think the other disruptions are some of the other disruptions well known. Dr. Mays talked about these disruptions to our education and day-to-day activities for children, disruption to economic stability, which can impact the well-being of children and certainly impact stress levels for families. And as the Surgeon General noted, disruptions to our societal fabric. We've seen increased culture of hostility and tension, and this toxicity really does impact our children. And so I think, it's no surprise, right, that it's no surprise that these things also impact our children's mental health. Again, I think Dr. May covered a lot of this very well, but we've seen increased rates, increased severity, and decreased access all at the same time. I think two subpopulations that we've seen data recently that are particularly concerning are young girls who have had pretty high rates of increase, as well as our LGBTQ plus youth. And I think, right, there's also the stress on our workforce. And so we have less capacity to care for children with mental health concerns, and a lot of stress on families and communities. And so it's harder for all of these supportive resources to buffer these stresses for children. So a lot of impacts across the board. And I think, we also I can't finish without mentioning two things. Certainly, I think that the past 3 years has created an outsized impact of social media on our youth. It's always been an influence on children, some pro-social things, some not good things as well. But I think certainly those impacts were amplified over the past 3 years. And I think it's also incredibly important to note that all of these things I discussed and so many more are not, these disruptions are not experienced equally by children and families across our nation. And there are many who are much more profoundly impacted than others. And so it's important when we think about solutions for us to think about how do we ensure that we're pouring more into those families and into those communities. And I think just to close, because I really hate saying all the negative stuff without getting a chance to say one or two positive things as well, because I do think that there are a lot of things we can do here. This has been an incredibly traumatic and challenging time for children and families, but this is going to take a whole of society approach to making things better. But I think that gives us power. It gives us each something to do, and it gives us each a way that we can help build up children and families. And I know we'll talk about this, but literacy, of course, plays an incredibly important role in that. So thank you.
Thank you, Lee, Dr. Beers. David, I want to turn to you now because you are on the ground in schools with real students and real teachers. What have you seen from your work with the Urban Assembly? How are kids doing and their teachers from a social emotional perspective?
Well, it's a great question, Amanda. And I agree with Linda and Lee across a number of the things that they talked about with regards to the relationships between social emotional development, mental health outcomes, and literacy as a whole. So when I want to start with this notion that social emotional development and language development are intimately linked. When we're thinking about, for example, students classified as emotionally disturbed under IEDEA as a special education category, the estimates around 71% of them have language challenges or language deficits, specifically what we call pragmatics, right? Being able to identify turn-taking in conversations, speaker-listener relationships, things of that era. And some of those estimates go up to about 90% of students classified as what we call emotional disturbance or emotional behavioral disturbed vis-a-vis the federal law. have comorbid challenges around language expression and receptive kind of challenges in that space. And so the relationship between emotional vocabulary, the way that we understand ourselves and the language that we have to understand ourselves and others, and our social emotional competence, it's very intimately linked, right? In fact, we can kind of predict a student's social emotional competency just based on the amount of emotion words that they can use fluently to describe themselves in a situation. I want to give a shout out to the ruler approach that comes out of the Emotional Intelligence Laboratory over at Yale. And that whole approach is really focused on really developing the emotional vocabulary of young people so they can construct a worldview based on the language that they're using to understand themselves and others. So the first thing I want to really land out for our audience is that that language development and social emotional development is intimately linked. Now, I've got two kids, 9 and 10 years old, and I will never forget my older son, Elijah, when he hit about 2 and 3, he had this mismatch. Right, he had developed intention, so he was starting to individuate against his parents. So that means he had his own sense of self and who he wanted and what he wanted to do, but he had not yet developed the language to match that intention to the actual reality that he was trying to accomplish. And so we know when we have intent without language, we get behavior. And so my child Elijah really struggled in those terrible 2s to express himself. Because he knew what he wanted, but didn't have the language to develop it. So what I want to do first is just ground that notion. Social emotional development and language development are very closely related. The next thing I want to say briefly is that the development of language in classroom and literacy more broadly in the classroom is very closely linked to the relational aspects of student teacher and the learning and interactions that underlie those pieces. So when we're talking about what it means to learn in classrooms, what we do know is that when we have high amounts of emotional support from teachers, that means student sensitivity, paying attention to student cues, being able to identify student needs in the moment and adjust pacing to those spaces as measured by the classroom assessment scoring system. Students who have the highest risk of reading difficulties do better. So teachers who are more sensitive in the classroom, who have high amounts of emotional support, are more likely to support student literacy. So it's another aspect of this notion of social emotional development for, in this case, teachers, and then literacy development for this case, students, that is overall kind of founding or grounding our understanding that these two things are strongly linked. When we organize our instructional interactions in the classroom, we need to think about both social emotional development and language development. And when we look at the challenges that young people have, we need to understand the social emotional component of those challenges, the language component of those challenges, and see how they're interacting so that young people are successful, not only what they read, but who they are and how they present themselves to the world.
Thanks, David. I appreciate you highlighting how gaps in expressive and receptive language can pose their own sets of challenges in the classroom. I'd like for all of you at this time to respond to your thoughts on literacy specifically and the ways in which you've seen literacy, including reading and storytelling, play a role in supporting a child's overall health and well-being.
Well, I can start. And I think that, let me just go back to storytelling. And by storytelling, it's not just a skill that is about fictional storytelling. It's about the ability to narrate your world with a past, a present, a future. The ability to connect to someone and say, remember that? Did you see that? Do you remember when we did X, or you remember that or Y? So by that very virtue of creating that story, you're creating a social connection. And we know a tremendous amount, actually, even more than we know about literacy. We know a tremendous amount about social networks and the health impact of social networks. So if we had to talk in a kind of mechanism way, how does literacy work and its impact on health? I think that's one of the mechanisms, by strengthening social networks, strengthening communities, and through storytelling and building that kind of shared narrative. Books do the same, but narrative actually in a way is a precursor to reading. So that would be one that I would suggest.
Thanks, Linda. I appreciate you highlighting the importance that social capital and
Yeah.
social networks plays in all of this.
Absolutely.
Yeah,
Linda, Dave?
if I would just add on to what Linda said, I mean, I think, I do a lot of work in DC around helping to support families whose children are experiencing adversity in a variety of different ways. And one of the things that we know, just building on what Linda was just saying, is that one of the most important things that can buffer children from the impacts of stress and adversity is safe, stable, and nurturing relationships. And so storytelling and reading and literacy builds up those safe, stable, and nurturing relationships in so many different ways. I think the other thing I'll add that was highlighted in the report, which I do think is important, is this concept of health literacy, and literacy contributing to a young person as they grow grow older from early childhood to school age to adolescence to adulthood, to really understanding their health and their health care and how to engage with that health care. And that is an incredibly important skill to have for lifelong health and well-being. And I think that I appreciated that the report highlighted that link to health literacy as well.
Yeah, Amanda, if I could just follow up on what Linda said, because she really presented an incredibly nuanced view around this notion of literacy. So Neil Postman writes in The End of Education, right, that language constructs our worldview, right? Literally, the words that we have impact the way that we see the world. And when we talk about this notion of a narrative, right, we talk about how young people see themselves in relationship to the rest of the world. And when we talk about things like cognitive behavioral therapy, we talk about things like even psychodynamic approaches. A lot of it is, what is a narrative that we're using to understand the systems and structures in the world, and how are we using that narrative with how do we use that narrative with ourselves? And so the notion of literacy and its ability to construct a shared narrative in the context of like social capital, social community, what's happening to us and why, but also to construct an individual narrative. What is my role in this world? How do I understand the forces that are arrayed against me and why? How do I understand my efficacy? All those things are deeply intertwined with our ability to construct a worldview and the language that we have to do so. So I just want to really, really double tap the things that Linda is talking about with regards to narrative, and the use of language to construct narratives that are either empowering, create efficacy, or depowering and create apathy and cynicism.
Thank you all. I'd love for us now to really dig a little bit deeper into SEL. And I'm going to turn to you, David, again, because you are a well-respected national expert on the topic. In fact, you co-authored a paper, Instructional Interactions and Literacy, Supporting Classroom Instruction Through Teachers' Social-Emotional Skill Development, with Dr. Bridget Hemray, also an expert whose research focused on teacher-child interactions. So I thought it'd be great if you could speak briefly to its content and its relevant to this conversation that we're having now.
I appreciate the opportunity, Amanda. So I'm just going to really focus on the role of teacher social emotional skills and engaging young people in the instructional interactions that drive learning. I think there has been, and this is a really important development in education, a really good emphasis on the kinds of phonics development that allow students to really match sounds to words. And I think this has been a really important evolution in how we think about the kinds of curriculum that work. But I don't want us to forget that what drives literacy is not necessarily curriculum, but it's quality interactions between students, materials, and language. Right. One of the reasons why during the pandemic that literacy was relatively flat and math took a huge dive is because the quality of interactions and the frequency of interactions was strongly related to students' ability to get into social interactions, to get into schools that drive high quality learning and language development. And we saw this in terms of what students had the most negative outcomes from the pandemic. And those were students who were English language learners, students who were special education, students who came from backgrounds that didn't necessarily have the quality of interactions in terms of literacy that they would get into school. So from this paper, we just want to really identify a couple of things. One, teachers' social emotional skills matter in terms of developing the kinds of interactions that matter in the classroom. So perspective taking skills, being able to create opportunities for young people to engage in materials that are interesting to them. Social cue development. So teachers paying attention to the pacing of their language. Are students engaged? Too fast, too slow? Students have sensitivity. Are they creating opportunities for autonomy? All these things develop opportunities for higher order thinking, which literacy also enables. So the paper is really focused on this notion that instruction is not just about curriculum, it's about relationships. And you either relationships with the content or relationships with your teacher or your relationships with your peers. And all these things have to work together to develop that construction of the world and ourselves that we talked about when we talked about the narratives that propel high quality literacy in our education system.
Thanks, David. I'd like to now shift our conversation to policy and begin with you, Linda, Dr. Mays. I know this is an area of expertise for you, and I'd love for you to share with our audience now about the policies on health and education and what you see existing now.
It's a great question, and I'm smiling because I think Lee will also have some comments and thoughts about this as well as David. So I think that there's, in many states in the country, there is a divide between education and components of state government and that focus on health and focus on education. And yes, that's an organizational perhaps divide that maybe is for efficiency, but it doesn't work really well. And it doesn't work very well to put this message forward about literacy and health. So for example, how very important it is for a teacher to know that this particular child might be really, really struggling with asthma, and that their absenteeism relates to their health issues, and to understand that maybe to help them with their reading, et cetera, there needs to be something better put in place in collaboration with their pediatrician, because both are actually working health. Vice versa, that same pediatrician might not actually know that the child that he or she is really treating their asthma is missing a third of school days, and that is impactful for their health as whatever albuterol or whatever treatment they're doing for the asthma. But we don't have those data systems together. We don't have any way for either of those professionals to know that that's happening. Now, I realize by saying we should have those data systems together, we're opening up all sorts of HIPAA, et cetera, kinds of issues. But just thinking conceptually that if we really seriously take this message, then we need to integrate. We need to integrate those departments and those data. And we need to be thinking about how funding for schools impacts health, and that funding for health issues and mental health issues, do not get me started on funding for mental health issues, really impacts education. But I'll stop and turn it to Lee and David.
Yeah, Lee, I'd love to hear from you. You also have expertise in this space. I would love for you to shed some light on policy and advocacy.
Yeah, absolutely. And I in turn will really want to hear from David too. But I think even just to amplify, Linda, I don't even think you knew that this was something that was happening at Children's National, but just to sort of amplify your example, we have some of my colleagues in the Child Health Advocacy Institute have a pilot partner program with DC Public Schools where they are, maybe you did know this, where they're looking at absenteeism, connected through the school nurses. And indeed, we are seeing better outcomes in kids, when the pediatrician and the school are able to communicate around their health issues, right?
Right.
And I mean, the pediatricians they love it. The schools love it. And I think one of the additional pieces to think about around the policy and some of the financing solutions here are that one, we do need to break down these barriers between information sharing. We do need to really invest in good, confidential information sharing technological solutions that allow us to do this. And we need to invest in the staff to do that, because I think, pediatricians are just running at 1,000 miles a minute. educators and school staff are running at 1,000 miles a minute, right? And this sharing of information and these partnership does take time and expertise. And so thinking about policy solutions that will invest in creating those systems that allow that partnership and that collaboration to happen naturally, I think are just, we're very ready for it, and eager for it to happen.
And it's such a, and David, I'll turn, but it's such a fundamental, it in a sense, it's one of those no-brainers.
Right.
If you really think about children as whole beings, and education is investment for the life. But you're absolutely right. It cannot be an add-on. It can't be added on to the responsibilities of both professionals.
Amanda, I know there are questions in the Q&A, so I'll be brief on this.
Sure.
There shift towards informational text with the advent of the Common Core. And the reason for informational text shift was because complexity of the text, what most people needed to take out of text in terms of the world of work was informational. And so literature took a back seat to that. And I just want to really elevate what Linda and Lee are saying here. Yet it is literature, not informational text, that creates the capacity to develop this shared narrative about ourselves, that increases students' empathy, that allows students to see windows and mirrors into themselves and society and who we are as a people. And so I think as we shifted towards a more technocratic approach to education, where we were only focusing on how well do students read, as opposed to who students are and how what they read involves or supports who they are, we got to a place where we were focusing on kind of like social engineers, like students as engineers rather than students as humanistic people, and our education system representing that whole sense of self.
Thanks, David. I definitely want to get to the questions in the chat, but before we close out, there's one more thing that I hope that we can spend some time on. Actually, two more things. I want us to be optimistic and look towards the future, and let our imaginations run wild, of course, informed by research and our professional experiences. But, to all of you, as we look to the future, what are some ways that you can imagine the healthcare space incorporating literacy into their practice? And we touched on this a little bit before, but if there's anything more that you'd care to share in terms of the future.
I think we're already doing some of it. And I think it needs to be, as Lee is saying, we need to make it possible for pediatricians and other child health professionals to do, for example, reach out and read is a great intervention, to make it possible for people to do it without overstressing their practice or adding to the burden, to make it a natural extension of everything you do. It's just in the water, if you will, in the air of the practice, but it needs to have resources so that pediatricians aren't, oh my goodness, now I need to talk about literacy. It really needs to have it.
And I've heard you on many occasions talk about this, not only, in the context of the paper, but in other meetings that we've been in together, where you speak of, the importance of doctors in training, when they're in medical school, to begin to learn
Absolutely.
about this. Yeah. Do you want to share a little bit more about that?
Well, I mean, again, Lee, I'm a pediatrician too, but you're just very deeply immersed in the pediatric world. We don't get enough training. Pediatricians do not get enough training in basic child mental health. And I don't mean in a way mental health as being able to diagnose depression, et cetera, but to actually being able to think about child health, child developmental health, and the very basic early things that we can do as pediatricians to improve that. And thinking about 2-generation models and how parenting is a developmental stage as well. All of those things need to be really put into pediatric education. What we hear from our Connecticut pediatricians is that behavioral health and how they can impact it is the single greatest concern they have. That's the absolute single greatest concern. So Lee, I would turn to you, but yes, pediatric education, we do need to impact.
No, I think you have your finger right on the pulse. So, and the only thing I would add to that is that the more these concepts are embedded into our education around child mental health and to generational supports. I see a comment in the chat around engaging families. Yes, absolutely. The importance of literacy, the more these things are embedded into medical education throughout the spectrum, the more deeply medical providers will understand it, and the easier it will be for them to use those things that they know in their day-to-day interactions. So for example, if I'm seeing a patient for a well visit and I see a parent pull the book out of the diaper bag, and give it to their baby, I can say, that's amazing that you're doing that. That is such an important way to promote early childhood brain development and make a really strong relationship between you guys. And that takes me 10 seconds. But the only reason I know to do that is because I've had that education and training. And so the more we can embed it in all these different levels, the more we as medical professionals will be able to do that work in all those little different ways that do make a difference. I'd also add, the other thing I saw in the chat was pediatricians and public libraries make great partnerships. Yes, absolutely. So that was on my list of things to mention. I think partnerships is one way to leverage the fact that none of us have a lot of extra time. But when we come together and we partner together, that makes it a little bit easier. So,
yeah.
Great. David, would you like to chime in a little here and speak to what you envision for the future in terms of incorporating literacy and health?
Yeah. So I was sitting on a panel, and I don't know if this is true, so I'm going to defer to Lee and Linda on this, but I heard that 20% of health outcomes have to do with healthcare, and the other 80% are socially determined. Did I get that?
Yes,
All right.
it
I
may
like
even
throw
be less
stats.
than 20%.
All right, so that's
it's very humbling, I have to tell you.
Right. we don't really do a lot on the health side. We do.
It's a crazy stat. That's why I wrote it down, and I wanted to throw this out to our folks here, right? Like 20% of our health outcomes are based on our healthcare, right? So all the other stuff we do in life, social emotional development, the quality of social supports that we have, our literacy rates, all these things matter a lot. And so briefly, here are some key things around the future of this work. There was a study done in 2017, a meta-analysis of social and emotional learning interventions done by Teller, Durlock, identified that 20 years after exposure to social emotional learning programming, high quality, drug use goes down, relationships are more stable, more likely to be married, less likely to be using public housing, et cetera, et cetera, et cetera. So there's some foundational skills that matter. And these things predict things like literacy. They predict things like we talked about, the quality of relationships, and they're focused on things like interpersonal and intrapersonal problem solving. How do we equip young people to do those things? And so we want to talk about health outcomes. And I think one of the things that we need to do is start to look back at our education system and understand the role our education system can play in delivering whole people into society who are ready to solve problems and support community. And that means literacy, that means social and emotional development, that means all of the above. And we can help those health outcomes, that 80%, by delivering young people who are ready to solve those kinds of problems into the society.
Thank you all. Thank you, Lee. Thank you, David. And thank you, Linda, for sharing your expertise on this topic with our panelists. I think it makes sense now for us to turn to some of the questions in the Q&A. And I'm just going to read them aloud, and any of you feel free to respond. The first is, how can educators help to impact, build / develop students' narratives?
Amanda, I was starting to think about an answer to that question, because it's a great question. I think, David, you both will have some, but just to say, as a bit of a plug for Scholastic, is we're actually finishing a book on child and family resilience for teachers that will offer a number of classroom strategies that teachers can use to build narrative skills. But I don't know if my colleague Karen Baker wants to say anything about that, or turn to Lee and David.
Turn it to Lee and David.
Okay, all right, thanks, Karen.
Thoughts on student narratives?
Well, I'll jump in here with a really practical thing. This is a work that comes out of positive psychology, Marty Seligman, as well as the application of that work to things like the military in terms of resiliency. But it's just a simple concept of action, thoughts, and consequences that's taught in many SEL programs, right? What happened, what are your thoughts, and what happened as a result of those thoughts in terms of your behavior. And so the narratives that we develop need to be pulled out once people are starting to pay attention to what they're saying about themselves, your thoughts, and then what you do and how your thoughts and your behavior relate to each other. So in a very simple concept, right? What you think impacts what you do, and then what you do has consequences. And so being aware of what you think and the narratives that are propelling your behavior is a really important thing to support what you're doing. And in social work, we talk about the theory of reasoned action, right? And this notion of self-efficacy as a predictor for our ability to take into interventions and stay in interventions. The point here I want to raise to answer the question is raising awareness of thoughts and the impact of thoughts and behavior. It's a very simple step that teachers can do. Hey, what were you telling yourself when you did that thing? What problem were you trying to solve? That can create awareness, self-awareness, social emotional competency that helps us then predict things like decision-making skills and self-management.
Thanks, David. We have two similar questions in here, so I'm going to kind of combine them. But one person has asked that we comment on the recognized need for SEL and diverse books in schools, that it's definitely important for kids to see themselves in books, and the fact that books serve as mirrors, windows, and sliding doors. So if you could speak to that as it relates to some of the book banning that we have seen take place across the country.
I think in some ways, I mean, I can start, but I would very much want my colleagues as well. I think in some ways, our initial quietness to that question reflects how sobered and worried we all are about book banning and the social forces that lead that, to lead us to actually be afraid as a community, as a society, for all that we can learn and expand and multiple points of view. So that I think that was one thing that at least I was responding to. My worry about book banning, and then I would really hope that two of my colleagues might have a more positive frame, but my worry is that what it says is there are certain stories, that there are certain narratives that you cannot know and you cannot honor, and that should be pushed to the side. And that is an incredibly destructive force for children and for adults. I consider it as destructive as the pandemic and as a virus that sweeps across the country. I realize that that is a particular, perhaps liberal point of view, but I really think anything that constricts imagination and building of narrative skills is a threat to our society.
Thanks, Linda.
I'll defer to Lee before I speak.
Happily, I was going to give you a chance to first, but no, I echo your thoughts and concerns, Linda, and I think we do know. We absolutely know that for young people, being able to see themselves in the world around them and in literature is affirming, and it helps them to know who they are and that they're not alone, and it helps them to thrive emotionally, physically, and it helps them to thrive in schools. Strong social emotional skills are deeply tied to academic success and long-term health and success, right? And so these are not things that should be off to the side. These are really a part of helping children to grow and develop into the whole person that they can be and are meant to be, part of that is seeing themselves in books and in literature and in the world around them and in their teachers and in their communities and in their doctors and in their health systems. And so it is a goal that we we too often fall short of, but one that we have to keep striving for with urgency.
Yeah, it's validating and affirming. David?
Yeah, I'm in total agreement here. Linda opened up the conversation talking about shared narratives. You know, the challenge with creating narrative is that it has to incorporate multiple perspectives into one coherent story. And we have not been as successful at that narrative as we need to be in order to bring multiple varied values into a shared American story, which is honest, but which is also inclusive. And it's a very challenging thing to do. And the answer is not to stop people from trying. But I think it really goes back to this idea of what is the dominant kind of experience that folks have in this in society. Is it a cognitive one, or is it a narrative or emotional one? And I would argue that it's a mostly emotional experience. I don't know that folks spend as much time reasoning out theories of action as maybe you would do, Amanda or Lee or Linda or I. I think folks are sensitive to signals of in groups and out groups and who's in and who's out. And so this is all, to me, a call back to why literacy matters, because the ability to create a narrative means that you need to be exposed to narratives, you need to be accustomed to narratives. And the folks who will create that narrative are going to be the folks that bring people into a new America and a new society that is inclusive and brings people who are left out back into the fold, while also bringing folks who have been in the country for and empowering the country into the same space. And that's a challenge. And that's going to take folks with imagination. That's going to take folks with a sense of perspective taking, and with some narrative kind of gusto to make that work.
And I would just add that folks that have actually had the experience of hearing different narratives and being curious about them and bringing them together. And that's why it's so important to do this from very early on.
Thanks, Linda and David. Our next question focuses on vulnerable families. What's the best way to teach to reach the most vulnerable families in supporting them with more literacy activities at home with your kids? This person says, even if they themselves have had a difficult experience with literacy, reading was hard for them. And then they also are highlighting the fact that screens are more entertaining for everyone. Everybody is on a device, and that kind of complicates the matter. So any thoughts on reaching vulnerable families and competing with technology?
I think for me, one really important thing to remember and is that really, this is something that every family wants, right? They want their children to be thriving. They want their children to be happy and successful. And, I think when we start from that place and then think about, what are the barriers there? And how do we begin to break down those barriers? I think it takes a multifactorial approach. It can't be in just one place health or one place education or one place. It really has to take this whole of community approach where we can meet families where they are and where we can offer that. I think again, Reach Out and Read is such a wonderful example of that. Of that, right? We're bringing a book. I have families who I take care of in clinic for whom their entire library, their entire child library is made up of Reach Out and Read books. They have no other books. And so thinking about, there was also another wonderful program in DC called Books at Birth, where you could sign up and have a book mailed to you every month for free. So just thinking about how do we reach out? I think the final thing I'll say here is that you can't underestimate the importance of community and peer and family support here, because the peer leaders, community health workers, community health leaders are such an important part of our entire network. And they are often the ones who are the most trusted within their neighborhoods, within their communities, within their support systems. And so partnering together with them in our efforts is incredibly important too.
I think one thing
David,
that
any thoughts on vulnerable families?
I'll be brief on this. Look, I think Lee talked about this earlier, and I want to name that parents trust doctors more than they trust the education system, particularly parents from marginalized communities who didn't necessarily have a high quality interaction with the education system. So the things that Lee talked about, training pediatricians on naming some of the key aspects of high quality development. I've noticed you have your book, all those kind of stuff works. And I just want to give a shout out here to Ron Ferguson, who launched the Boston Basics, right? Who works to train community members and really simple things: sing and talk and play with your children, read to your children when possible. So these are things that we can get to a public health kind of level of dissemination and strategy and messaging. As Lee said, parents want to do this for their young people. Singing to your children, talking to your children, helping them play, count, and name things, it matters. And it turns out that the folks who are most trusted to do that are folks in the medical community. So they may be our best conversation, our starters in terms of making that happen on a consistent basis.
I think the one thing I would add for both of you, as Amanda earlier, you did comment that sometimes parents didn't have a great experience in the educational system, as you say, David. They don't really feel comfortable reading. But that's why, to get the message out that literacy starts with stories. Literacy starts with telling your child about how you're making breakfast and then narrating your day as you go through it. But that's really where it starts, and that everybody can do that.
Yeah, if I could just one more time what Linda is saying, like sometimes we make things very, very complicated, and that's why I like the Boston Basics. Narrating your day, hey, I'm going to work, using language is the thing that predicts language development and literacy, right? That's why we have such disparities in kindergarten. It's the language exposure. So there are real simple things that if we knocked it out every single day and folks were just hammering these messages, we would see an increase in behavior for the most vulnerable families, because everybody can narrate their day with their young people. And
then the other thing, you and I can riff back and forth. The other thing that I would say is that all of us tend to say, oh my goodness, there's too much screen time, there's too much television time. You can actually watch a Red Sox game or whatever your team is, but you can be narrating it with your child. You can actually say, can you believe what just happened? Or look at that. And this is why I like baseball. I mean, so screen time is not inherently bad, but it's actually, can you be there together with it? Can you be sharing those moments together?
Thanks, Linda. I definitely agree with that, except I'm not sure about the Red Sox.
Well, that's why I intentionally picked that
about
too.
The Yankees for me.
Amanda, if I got just one more thing,
sure.
That like if we could just get out to parents that high quality interactions matter. Interactions matter. That is what feeds the brain. And I know that's all I would say on this. Interactions matter. It takes a lot of effort to interact. I've had 2 children myself. Consistently with your children in pro-social ways. That's the hardest part of being a parent, is like conserving the energy to interact with your children in ways that develop their language, their social emotional skills, etc.
Right. Lee, did you have any thoughts to add, or I can move on to the next question. Go ahead.
I hear. I agree with all of it. I know we have lots.
Yeah, there's a comment in here speaking specifically about kindergarten teachers and the pressures that they felt, of course, because they are the teachers who have children who missed maybe preschool or daycare, pre-K3, pre-K4. And so I think the question that this person is getting at is the pressures that kindergarten teachers have faced. Do we believe that they're the same for first grade students? And maybe also wondering if you see value in looping or continuing with students for a second year. And maybe, David, you can respond to this as a practitioner on looping and kind of ensuring continuation of relationships between students and teachers from one year to the next.
Yeah, I could speak briefly on this. Good research on the role of looping and student attachment and belonging, particularly in post-secondary, no, excuse me, in secondary schools, so like 9 to 12. Our urban assembly schools use advisory so that there is one-on-one opportunities to work with teachers, and each student is well known for their social, emotional, and academic growth. I would say that to know a student and to watch the learning process is one of the things that we came out of the pandemic with a belief in, which I think is inaccurate, is that learning is about what students, what products they produce, rather than the process in which they engage in the learning and teaching learning kind of process. So paying attention to how students learn, their stress points, their zones of development in terms of what they need support on versus what they can do for themselves. All these things matter. And looping has got some good research with regards to its effect on emotional support for kids. And that in turn impacts their instructional understanding.
Thanks. There's a question in here. This is probably for our two doctors on the call here today, but it's do you consider the connections between uncorrected visual disorders and poor reading skills as a health issue? I think I know the answer, but I'd love for you guys to respond as professionals in this space.
Yeah, I mean, I think the short answer is yes, right? I mean, I think where I would go deeper is that it is part of why it's so critical for children at all ages, early childhood, but also I think, you forget that sometimes in the school age and the adolescent years until you need that sort of sports physical filled out, but that importance of sort of regular checkups and well-child checkups with the pediatrician, because, during those visits, we do a whole range of different health anticipatory guidance and health maintenance and screening type things. We look at vision, we look at, hearing, developmental screening at the younger ages, mental health screening at the older ages. It's one of the things I love about pediatrics is that it is a very preventative medicine specialty, and it's a very family engaged specialty. And I think that is why it's one of the things that I love about it, but I think it is also why it is so important for children to be coming in for those regular visits, because we can pick up on those things early that may interfere with literacy, that may interfere with learning. And again, going back to the partnership between schools and health systems, it's also why that partnership and communication is so important, because if I can pick up on those things early and be communicating with the school that I have picked up on those things, and we can work together to get the child the supports that they need earlier rather than later, then that's a success, right? That's what we want for children and families. So maybe I took a short question and expanded it to a long one, but...
Well, I appreciate your expansion on it. I mean, I was a former teacher myself, and kids who had visual impairments and hearing impairments were challenged, to learn how to read. And so it speaks to the need to integrate, the two, and to provide these services at or in close proximity to actual school buildings.
Mm-hmm.
Linda?
No, absolutely. Couldn't agree more. Totally.
Great. There's a question in here that refers to parenting skills. And it says some parents lack effective parenting skills because of their own upbringing. For instance, parents who talk at children instead of with children, they need models and guidance on how to assist their children about quality interactions. So this question is similar to the one about vulnerable families, but any thoughts on how we can develop the parenting skills of parents?
I can start on that one. So I think that one of the important perhaps reframes for all of us is that when anyone from wherever becomes a parent, that is actually a developmental stage, and that their brain is changing, their psychology is changing, and we, just as we would think about this may be too strong a metaphor, but just as we would not think about taking a 3-year-old and saying they're like a 12-year-old, we shouldn't say that a parent of an infant knows it all, because it really is a biological as well as psychological developmental stage. So I think that part of when we talk about parenting skills, it's actually important to really begin with asking the parent, what kind of parent do you want to be? How are the ways that you think about being a parent? What are the things that you'd like to do with your child? To really actually come at it not from here's what you need to do with your child, but rather, what do you want to do? Who do you want to be as you develop as a parent? And I think you can ask that question for every parent. And once you get that, what you'll begin to hear are the things that parents, they enjoy doing with their child, the things that they might want some help with. But I don't think that we should actually always presume that we know all the skills that people need. And rather, we should treat both of these individuals, child and parent, as developing and learning together.
I heard you in that response, Linda, really just doing some reframing, which is something that you always talk about in our conversations, with the steering committee, how important it is to sort of reframe and not come from sort of a deficit space, but looking towards the future and what can be.
Right, exactly.
Any thoughts on parenting, Lee or David?
I'm happy to let that Lee go first, and I'll hop in.
Yeah, no, I mean, it's a wonderful question. And Linda, I love that framing of it being developmental, because it also then, I think, shifts the way we think about it to away from more of a blame kind of framework to a partnership and supportive framework. I think, and I do this maybe even going back to my comment earlier about how critically important it is that we think about how we're partnering with families and community leaders. I think this is one really important place because, David, while I appreciate that your belief in families' trust in pediatricians and the medical system, there's a lot of barriers to that trust too. And there are a lot of power differentials. I think back to a young woman who's a teen mom who I took care of for many years, and we had a very good relationship. And so she was willing to say this to me, but we were talking about discipline and talking about positive discipline and not using corporal punishment. And she looked straight at me. She's like, Dr. Beers, you can't tell me that you don't pop your kids. I was like, no, I really don't. I swear I don't, and we had this long conversation about it, but I think, and we got to a good place. We had a good conversation, but that was because the two of us had a really strong relationship and good trust, which doesn't always exist. And I think so often, I may give advice as a pediatrician in the pediatrician's office, and my patient sort of looks at me and is like, yeah, whatever. I'm going to go do what I think is the right thing to do. And so I think, that is where, that is where it is so important for us to be working together, and for families have earned trust in a lot of different places with people in their community. And those are the folks who I think it's really important for us to be working together with to be sharing those messages and to help parents through those developmental stages.
Yeah, which speaks to the importance. Oh, go ahead.
Sorry, one more great model to add in. One of the things we've been doing in DC is parent cafes, which is built on the Strengthening Families framework, and that's a wonderful space actually for families to come together in a really pro-social way and have discussions about parenting and the stresses and supports that they're feeling. That really builds skills and self-confidence, and so that's a wonderful model that we love and use. But also just there's other similar models. So thinking about those ways where peers can come together too, in a supportive and a guided framework, I think is also can be really successful.
Yeah, and that speaks to the power and the importance of what we talked about before, the social networks, and how they can be leveraged in this space.
And could I give just one?
David, yeah, go ahead.
I
Go
was
ahead,
just
Linda.
going to, I was just going to give one more example because Lee, your example brought this one to mind. And some of my colleagues have heard me give this example, but I think it's profoundly illustrates what you are saying, Lee. So here it is very briefly. Mom working with a community provider, and extraordinarily hot in the summer. And the mom was talking about, she's pregnant and that this baby was causing so much trouble. And it was so hot and she couldn't wait to just have this baby. And really frustrated. Now you have a choice there. As a clinician, you could actually say, well, I know it's really hard, but you've really got to get ready for the baby because you've got to do this and this and this. Or you can do what this clinician did. And she said, why don't you tell your baby about it? And so the mom did. She started talking to her baby. And when the baby was born, they had a shared narrative about how hot that summer had been. And did the baby remember those stories? Now, what was the profound shift was not to say, oh, you can't be feeling that way because, you got something coming up here that's going to be really big. The profound shift was to say, yeah, I know. And you've got a shared story. And it's a story of how you're developing as a parent as well. And so I think that's the point we're trying to make. I don't know if that's helpful.
Thanks, Linda. David?
I feel bad now, Linda, because I'm going to quote some of the Fragile Families research coming out of Princeton, and it's less optimistic than that, but I really appreciate that notion of how do we build the kind of habits that matter. What I want to say briefly on this is, I'm trying to say this in a way that I think will land effectively, but so what predicts student kind of cognitive development in schools and academic outcomes? A lot of it has to do with maternal reading levels and where their parents are coming from. And when we are able to kind of get above and beyond what those predictions are, we as schools feel proud of ourselves. So we say, okay, look, the predicted outcome of the student would be X, Y, and Z, but the value out of our quality of education and instructional interactions are X because we got above those predictions. Maternal stress matters, and how we protect young people from challenges in the environment is often mediated through responsiveness of, in this case, often mothers to their children. And so I agree with Linda very strongly that we don't have to say, here's what you're doing wrong as a parent. There are some real key things that help young people develop effectively. And I do want to name that the sensitivity towards boys versus girls is higher, right? So boys are actually more sensitive to these issues of maternal responsivity to stress because of poverty. So to the extent that we can build those things, and I got to go back to those Boston basics. I'm not asking us to be super moms and super dads, but I think we can do more to show people what kinds of things matter in the development of their children without blaming them and say you're doing a bad job. So I want to raise that up, and it's really important for me. If I had a magic wand, I would say every single child who had a child, person had a child, would go through a 30-minute video and would just say things like sing and talk to your child and show them love versus just simple things. Right now, when you're foster mom or you're adopting children, there's this rigorous kind of here's how to be a good parent. You got to pass tests and all these social workers. But me and my wife, we just had some kids, right? So to the extent that we can invest in the supports, and one last thing I'll say, and Lee said about this, and I just really want to double tap this very clearly, social support for parents reduces the stress response, right? And so we've moved into this kind of isolated parenting approach, which was historically not how we raised kids because it's super stressful, right? So we can—
It takes a village.
It takes a village. So if we can get more social support, we can reduce maternal stress, we can increase maternal responsiveness, and student social, emotional, and academic development would benefit from that, or children would.
David, I would agree with you about the video, that I would have exactly that message in that 30-second or 30 whatever minute video. The only other thing I would add to it would be something to the effect of, and some days you just won't be able to do it. so that everybody, you don't feel like, so it's in essence allowing for the individuality of the
Yeah.
adult as well.
And gives you the space to make a mistake and not be perfect.
Absolutely, absolutely, right,
Great.
absolutely, right.
That's that good enough parenting, right?
Yeah, absolutely, right, right.
Which we all had. David, Lee, and Linda, thank you so very, very much for joining me in this conversation. I'm going to turn it over to Becky now, who's going to launch a post-webinar poll, and we ask that the participants take the poll. Becky.
Well, thank you, Amanda, so much for moderating this extraordinary conversation. Linda and Lee and David, this has just been amazing. And we have some metrics that we watch during the course of the webinar, how many people come on and how many people stay. And the number of people who both came on and stayed for this one was quite high. So it goes to show you that this topic, it was incredibly important to everyone. So thank you for taking the time to join us today.
Okay.
Here for all the work on the research paper and all the work that you're going to continue to do. Thank you, Sierra, in the background for helping us to have a smooth webinar. Do please take the time to fill out our poll because it helps us know how to be better for you. And all these resources will be coming out later this week. We would love to have you join us for some of our upcoming conversations next week on diverse books. That topic came up today, so please register and join us, and we will see you all very soon. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank
Bye.
you all. Wonderful evening.
Thank you all. Thanks.